Have you ever been jolted awake in the middle of the night by an excruciating leg cramp? Are you tired of this happening over and over again? Surprisingly, there's one vitamin that almost no one thinks about that can significantly reduce cramping. What exactly is this vitamin and why is it so important for diabetics' health? Stay tuned until the end of this video because I'll prove to you why you can't afford to ignore it. Let's get started. People are wrong about vitamin D. When experiencing leg cramps, most of us immediately think of magnesium, potassium, or calcium, essential minerals that can help prevent cramping. But there's one vitamin few people consider, and it might play a more crucial role than you think: vitamin D. Think about it, when you hear vitamin D, what's the first thing that comes to mind? Is it preventing osteoporosis and keeping bones strong? That's true, but it's not the whole story. What many people don't realize is that vitamin D isn't just important for bones. It directly affects how your muscles and nerves function. And here's something even more important: if you have diabetes, your risk of vitamin D deficiency is much higher than you might have ever realized. So can vitamin D really help reduce cramping? And why should diabetics pay special attention to it? I'll help you find the answers right now. Why is vitamin D the key to preventing cramps? The answer lies in how vitamin D helps your body absorb calcium and magnesium. Both minerals are extremely important for smooth muscle function. Calcium helps muscles contract, while magnesium helps them relax. If you're deficient in either one, your muscles can fall into a state of continuous contraction, causing painful cramps. But here's the crucial point: without sufficient vitamin D, your body won't properly absorb calcium and magnesium. You could drink plenty of calcium-rich milk or supplement with magnesium, but if your vitamin D is insufficient, they simply can't work effectively. But it doesn't stop there. Vitamin D also has a direct impact on your nervous system. Every muscle movement is controlled by nerves. When the nervous system has problems, signals to muscles can become disrupted, leading to abnormal muscle contractions. For diabetics, this is even more serious due to the risk of diabetic neuropathy, which weakens the nervous system and increases the likelihood of cramping. When your body lacks vitamin D, your ability to control muscle activity diminishes, making you more susceptible to sudden spasms. Not only does vitamin D help your muscles and nervous system function more smoothly, but it also supports potassium balance, another crucial mineral that helps muscles relax. If potassium becomes imbalanced, muscles can suddenly tighten, resulting in cramps. Vitamin D plays a role in regulating potassium levels in the body, ensuring that muscles can properly relax after contracting. And there's another important factor that few people notice: blood circulation. Diabetics often experience circulation problems, preventing blood from efficiently flowing to muscles. When circulation is poor, muscles don't receive enough oxygen and necessary nutrients, leading to cramping and numbness. Vitamin D helps maintain healthy blood vessels, improving blood flow to the extremities and reducing the risk of cramps caused by poor circulation. Additionally, vitamin D is an extremely important factor for leg strength in diabetics. As we age, our bodies go through inevitable changes: muscle mass decreases, bone density declines, and movements that were once easy become more difficult. One of the most overlooked causes is vitamin D deficiency. Not only related to bone health, vitamin D plays a crucial role in maintaining healthy, balanced, and flexible legs. Our skin has the ability to synthesize vitamin D from sunlight, but this ability gradually decreases with age. This becomes more serious when many older people spend less time outdoors due to mobility limitations, lifestyle changes, or concerns about skin damage. As a result, vitamin D deficiency becomes common, weakening muscle strength, making legs unstable, and increasing the risk of falls. Studies have shown that low vitamin D levels are directly related to muscle weakness and loss of balance in older adults. A study published in the Journal of Clinical Endocrinology and Metabolism showed that elderly people with sufficient vitamin D levels had stronger muscle fibers, better coordination, and more stable balance, significantly reducing the risk of falls and fractures. In contrast, those with vitamin D deficiency lose muscle faster, making even simple activities like climbing stairs or standing up from a chair challenging. Ensuring adequate vitamin D not only helps strengthen muscles but also protects your legs from the negative effects of aging. If you want to maintain mobility, flexibility, and overall health, vitamin D is certainly one nutrient you cannot ignore. Are diabetics more prone to vitamin D deficiency? If you experience frequent cramps, especially at night, your body may be sending you a warning signal that you're deficient in vitamin D. This isn't just a vitamin for bones, but an important factor that helps muscles function properly, supports the nervous system, and improves circulation. If you have diabetes, you need to pay even more attention, as your chance of being vitamin D deficient is higher than normal, something you may have never realized. Studies have shown that diabetes patients, especially those with type 2 diabetes, have a significantly higher risk of vitamin D deficiency compared to non-diabetics. This happens for various reasons, and unfortunately, most people don't realize they're lacking vitamin D until the symptoms become obvious. One of the biggest causes is dietary deficiency. Many people don't consume enough vitamin D-rich foods like fatty fish, salmon, mackerel, sardines, eggs, and vitamin D-fortified dairy products. If you don't regularly eat these foods, you may have unintentionally missed an important source of vitamin D that your body needs to function healthily. Another important factor is insufficient exposure to sunlight. Do you remember the last time you spent at least 20 to 30 minutes in natural sunlight? As we age, the tendency to stay indoors more, avoid sunlight, or use sunscreen regularly prevents our bodies from producing enough vitamin D. Especially for people with diabetes, they may exercise outdoors less due to accompanying health issues, which significantly reduces the ability to naturally synthesize vitamin D from sunlight. But the deeper and more serious cause is metabolic disorder due to insulin resistance. When someone has type 2 diabetes, their body struggles to use insulin properly, which directly affects the ability to absorb and utilize vitamin D effectively. In fact, some studies have indicated that vitamin D deficiency can worsen insulin resistance, creating a vicious cycle that makes diabetics even more susceptible to vitamin D deficiency without realizing it. So how do you know if you're deficient in vitamin D? Pay attention to the signals your body is trying to send you. If you frequently experience unexplained muscle pain, especially in your legs and back, get night cramps, feel prolonged fatigue despite adequate sleep, or have sensations of weak bones and aching limbs, it's very possible that your body is deficient in vitamin D. Do you find yourself experiencing one or more of these symptoms? If so, don't worry, because right now, I'm going to guide you on how to supplement vitamin D most effectively to prevent cramps and improve your overall health. Most effective ways to supplement vitamin D for diabetics. To optimize your vitamin D levels and ensure your body absorbs enough of what it needs, especially if you have diabetes, you need to know the right supplementation methods. It's not as simple as just taking a supplement pill to solve the problem. Our bodies have a unique mechanism for absorbing vitamin D, and if you don't pay attention to these factors, you might still be deficient despite your supplementation efforts. The most natural way to boost vitamin D is through sunlight exposure. Our skin can produce vitamin D when exposed to UVB rays from the sun. But what many people don't know is that this ability decreases with age. As we get older, our skin becomes less efficient at synthesizing vitamin D, making people over 50 at higher risk of deficiency. So, if you're in this age group, make sure to spend at least 20 to 30 minutes outdoors 3 to 4 times a week. The optimal time for vitamin D synthesis is from 10 a.m. to 2 p.m., when UVB intensity is strongest. However, if you live in an area with long winters or frequent cloud cover, you may not get enough sunlight to produce sufficient vitamin D, making dietary sources and supplements more important. If you can't get enough sun exposure, diet is the next factor to focus on. Some natural foods are very rich in vitamin D, such as fatty fish, salmon, mackerel, sardines, egg yolks, milk, and fortified orange juice. Mushrooms are an excellent choice for vegetarians as they're the only plant-based food that can synthesize vitamin D when exposed to sunlight. Therefore, you must increase your intake of these natural foods in your daily menu to provide your body with sufficient vitamins. Should you take supplements to boost vitamin D? The answer is yes, if you can't get enough from diet and sunlight. Vitamin D3, cholecalciferol, is the most effective form, absorbed much better than vitamin D2. The recommended safe dosage for diabetics is 600 to 800 IU/day for people under 70 and 800-1000 IU/day for those over 70. However, if you have a severe deficiency, your doctor may prescribe a higher dose for a short period to quickly bring your vitamin D levels back to normal. One thing to note, don't take high doses without checking your blood vitamin D levels. Excess vitamin D can lead to too much calcium in the blood, causing kidney stones or affecting cardiovascular function. Therefore, before starting any supplement, discuss with your doctor to determine the most appropriate dosage for your body and health condition. Another important factor that few people notice is the relationship between magnesium and vitamin D. The body needs magnesium to activate vitamin D, so if you're deficient in magnesium, no matter how much vitamin D you supplement, your body can't use it effectively. Magnesium-rich foods like brown rice, oatmeal, leafy greens, spinach, kale, and nuts, almonds, pumpkin seeds, should be incorporated into your diet to optimize vitamin D effectiveness. If you find it difficult to get enough magnesium from food alone, consider additional supplements, as magnesium not only helps activate vitamin D but also improves muscle and nervous system health, helping prevent cramps better. A common question many people ask is, how long does it take to see results when supplementing vitamin D? The answer depends on your initial level of deficiency. If your deficiency is severe, it might take weeks or even months to reach ideal levels and feel the difference. However, according to studies, most people can expect changes in stages. After about 2 weeks, cramps start to gradually decrease, with muscles experiencing fewer spasms. After 1 month, you may feel more energetic, with reduced feelings of prolonged fatigue. After 3 months, leg muscles become stronger, with noticeably improved balance. And after 6 months, bone density increases significantly, helping reduce the risk of fractures and falls in older adults. One study showed that elderly people who adequately supplemented with vitamin D for 3 to 6 months had 31% fewer cramps, 35% stronger muscles, and a 40% reduced risk of bone fractures compared to those deficient in vitamin D. The most important thing is persistence. Vitamin D supplementation isn't a solution that will show immediate results, but if you maintain it regularly, the difference will become evident over time. Muscles become stronger, mobility improves, and most importantly, you can minimize those uncomfortable nighttime cramps. Other essential vitamins for preventing cramps in people with diabetes. To optimize muscle health and reduce the risk of cramps, in addition to vitamin D, several other vitamins play a crucial role in maintaining nerve function, muscle performance, and blood circulation. For individuals with diabetes, the right combination of these vitamins can significantly improve mobility, reduce numbness, and prevent nighttime cramps. One of the most important vitamins is vitamin B12, an essential nutrient for neuromuscular function. While most people focus on calcium and protein for maintaining muscle strength, vitamin B12 serves as the foundation for healthy nerves, ensuring that nerve signals to the muscles remain accurate and strong. When the body lacks vitamin B12, muscles fail to receive proper nerve signals, leading to weakness, loss of coordination, and a heavy sensation in the legs. A common sign of vitamin B12 deficiency is persistent numbness, tingling, or fatigue in the legs. What's even more concerning is that vitamin B12 deficiency is particularly common in older adults due to the body's declining ability to absorb this nutrient over time. Unlike many other vitamins that can be stored in the body, vitamin B12 relies heavily on a well-functioning digestive system for proper absorption. As we age, stomach acid levels decrease, and digestive conditions such as gastritis, acid reflux, or long-term use of antacids can interfere with the body's ability to extract enough vitamin B12 from food. A deficiency in vitamin B12 not only contributes to muscle weakness but can also lead to irreversible nerve damage if left untreated. Many older adults experiencing balance issues, frequent falls, or a decline in leg mobility may actually be suffering from the long-term effects of vitamin B12 deficiency. The good news is that vitamin B12 supplementation can significantly improve muscle strength, coordination, and energy levels. Foods rich in vitamin B12 include lean meats, fish, eggs, dairy, and shellfish such as oysters or animal liver. For those following a vegetarian diet or struggling with absorption issues, fortified plant-based milk and cereals can serve as alternative sources. In many cases, older adults may need vitamin B12 supplements in the form of oral tablets or periodic injections to maintain optimal levels, prevent nerve deterioration, and keep their legs strong over time. Not only vitamin B12, but vitamin K also plays a crucial role in maintaining bone and muscle health. When it comes to essential vitamins for strong bones, most people immediately think of calcium and vitamin D, often overlooking the critical role of vitamin K. This vitamin ensures that calcium is properly absorbed into the bones instead of accumulating in arteries or soft tissues, where it can lead to poor circulation and even cardiovascular problems. In other words, vitamin K acts like a traffic controller, directing calcium to the right places to strengthen bones while maintaining their flexibility. For older adults, vitamin K is especially important as it reduces the risk of fractures, supports joint strength, and helps prevent osteoarthritis. Some studies suggest that individuals with adequate vitamin K intake have lower osteoporosis risk, stronger bones, and better mobility than those with deficiencies. Vitamin K is not only essential for bone health but also plays a key role in joint health and muscle function. It helps reduce inflammation in the joints, slows the progression of osteoarthritis, and minimizes joint stiffness, a common issue among older adults. If you experience stiff knees after prolonged sitting or joint pain when moving, there's a chance your body may be deficient in vitamin K. Additionally, research indicates that vitamin K supports muscle coordination and strength, helping to prevent falls due to balance issues in older adults. Good dietary sources of vitamin K include leafy greens such as kale, spinach, Brussels sprouts, and fermented foods like natto. For those who have difficulty absorbing vitamin K from food or are on blood-thinning medications, it's important to consult a doctor before taking supplements. Alongside vitamin B12 and vitamin K, vitamin B6 also plays a vital role in nerve and muscle function. Vitamin B6 not only aids in muscle repair but also helps the body utilize protein efficiently to maintain muscle mass. When vitamin B6 levels are low, muscles may weaken over time, making even simple tasks like standing up from a chair or climbing stairs more challenging. One of the biggest impacts of vitamin B6 deficiency is its effect on nerve signaling and muscle coordination. If levels are too low, the nervous system may transmit signals at a slower rate, leading to numbness, tingling sensations, and unsteady movements. Beyond maintaining nerve function, vitamin B6 also plays a key role in preventing muscle fatigue caused by inflammation. It helps regulate the body's inflammatory response, reducing muscle discomfort and improving flexibility. If you frequently experience muscle stiffness or slow recovery after physical activity, there's a chance your vitamin B6 levels are suboptimal. Additionally, vitamin B6 contributes to red blood cell production, ensuring adequate oxygen delivery to the muscles, which supports endurance and prevents fatigue. Good dietary sources of vitamin B6 include salmon, tuna, poultry, bananas, potatoes, chickpeas, and fortified cereals. For individuals with digestive issues or absorption difficulties, vitamin B6 supplementation may help maintain stable levels. However, excessive intake of vitamin B6 from supplements can lead to adverse effects, so it's best to focus on a well-balanced diet to meet daily requirements without risking an overdose. Supplementing with vitamin D is a crucial step in preventing muscle cramps, but if you want to optimize muscle and nervous system health, make sure your body is also getting enough vitamin B12, vitamin K, and vitamin B6. These essential nutrients don't just help reduce cramps, they also enhance muscle strength, improve mobility, and prevent nerve-related complications in people with diabetes. If you've ever felt weak legs, numbness, or balance issues, it could be a sign that your body needs more than just one vitamin. Start adjusting your diet and supplementation today to protect your legs and overall health for the future. Cramps, balance issues, and muscle weakness. These symptoms, often dismissed as part of aging, may actually be warning signs of a vitamin D deficiency. This vitamin is not only essential for strong bones but also plays a key role in nerve and muscle function, helping to maintain flexibility, stability, and strength in your legs. For people with diabetes, vitamin D deficiency is even more common, increasing the risk of falls and mobility decline. The good news is you can take control of this. By supplementing with vitamin D correctly, getting enough sunlight, adjusting your diet, and using supplements if necessary, you can help your body absorb calcium and magnesium more effectively, improve circulation, strengthen muscles, and reduce nighttime cramps. Additionally, combining vitamin D with other key vitamins like vitamin B12, vitamin K, and vitamin B6 will further optimize nerve function, preserve muscle mass, and keep your body moving with ease. So, what are you waiting for? Start today. Check your vitamin D levels, adjust your lifestyle to ensure your body gets the nutrients it needs, and don't let silent deficiencies weaken your legs over time. A small change today can make a big difference in your long-term health and quality of life. Stay tuned for more valuable health insights, and I'll see you in the next video.